Hello, I'm Robin Devine and I'm the owner of Lymph Balance Center here in Calgary, Alberta, and I'm also a massage therapist and a certified lymphedema therapist, as well as an instructor for the Chickley Health Institute and for the lymph drainage therapy program. So what I'm doing today is I'm going to show you if you have swelling or any concerns of lymphatic congestion in your arm, how to do some self-drainage techniques to help move that fluid. Now, one of the things that we need to talk about before we do any of this is some of the precautions that we need to take to make sure that this is a safe technique to do for you. So the very first thing is that if you have an acute infection, you have a cold, you have the flu, any of those things, you have a red, hot, burning area on your arm, it's swollen, it's red, it's hot, it's itchy, it's painful, all those are really good reasons not to do lymphatic work, okay? The second thing is if you have lymphedema, or you have had lymph nodes removed or radiation therapy, we're going to make sure that you are not doing the routine that I'm about to show you. What you need to do is you need to go see a certified lymphedema therapist to have them map and feel where your lymph is trying to go. When you have lymphedema or you've had radiation therapy, most of the time we'll see that your lymph will start moving in unique pathways. So what that means is that it's not going to do the textbook movement of lymphatic fluid. So it would not be advisable for you to do the sequence that I'm going to show you today, okay? So the very first thing is all the lymph in your entire body is trying to get to the base of your neck. So if you can feel your sternum, okay? You can also feel your collarbone. So I want you to feel your collarbone coming all the way into the middle, and you'll feel these nice little balls, these bones, these joints, right at the base of your neck. And in medical terminology, we call this the sternoclavicular joint. So you can see my clavicles right there. I'm pushing my shoulders up so you can see this. My clavicles or my collarbone, and where they attach onto my sternum, which goes right down the center of my chest, that is your sternoclavicular joint. So right above those balls, that joint right there, you have a nice little soft spot. And this is where all the lymph in your entire body is trying to get to. So what we're going to do is we're going to take 1 or 2 fingers and place them in that little soft spot. And with sticky fingers, so not sliding over the skin, but I want you to imagine that you're like Spider-Man and you can climb walls with your really sticky fingers. Same thing, we're going to stretch the skin down. So what we're going to do is we're going to use our sticky fingers and drag the skin down. We're just stretching the skin down towards our feet. And we're going to do this 3 to 5 times. If you're feeling really ambitious, you can do 5 to 10 times. Again, as long as you don't have an infection or anything along those lines where we're not worried about you having a fever or spreading an infection, you can do this 20 times if you really feel it, okay? Now, all the lymph is trying to go there, but today we're going to focus on the arm. So let's say you have tendinitis, let's say you have carpal tunnel, let's say you have a repetitive strain in your elbow like tennis or golfer's elbow, or maybe you have frozen shoulder. Any of those conditions where there might be some extra swelling, we're going to go and do some lymphatic work to help that. So the first thing we're going to do is we're going to go to the group of nodes that are found in our armpit. So these are called our axillary nodes. Now, in our armpit, it's not just on the skin, but it actually goes deep inside the joint. So our direction, we're actually going to help move the lymph from the armpit going up towards that point that we just did at the base of the neck. So we're going to take our flat hand and place it into our armpit, and we're going to send the lymph up on a 45-degree angle if you want to think towards the base of the neck, or even sometimes towards the chin is a good way to think about it. Flat fingers, and we're just going to compress the tissue. Now, if I bring my arm all the way up like this, it's really hard. I can't actually press into the armpit. So I might want to have my hand resting on my knee and have my hand there and just pressing up again towards the base of the neck or towards the chin. So we're going to do that good 3 to 5 times. Okay? So these are really good self-care things. Of course, if you have lots of swelling or congestion, we're really going to encourage that you go see a lymphatic therapist, because they're going to be the ones who are going to be able to find where there might be blockages and be very specific with their treatment. But again, this is just help self-care when you can't get to a therapist or in between sessions. Okay? The next thing we're going to do is we're going to do our upper arm. So with our sticky fingers, we're going to place our hand just on the inside of our upper arm. Okay? So again, if I rest my hand down on my knee, I can get my hand in that position, and I'm just going to stretch the skin towards my armpit. So my hand is in that position. I'm stretching towards my armpit. And I'm going to do as many strokes as I want. Maybe it's going to be 3 or 5, I'm not sure. But I'm going to work my way all the way down to my elbow. Okay? If you don't feel the stretchiness of the skin, or maybe you can't because you're wearing a garment, or you have a long sleeve, or you have to wear gloves, I don't know. But another thing you can do is just starting at the elbow and just stroking the skin up towards the armpit. Okay? All the lymph in your arm is trying to get towards your armpit, so that's where we're going to help it move. Okay? In the crease of the elbow, what we can do is we can place 2 or 3 fingers just at the crease, and we're going to stretch the skin, again, up towards the armpit. So we're just going to stretch that, moving up. Okay? Same thing with the forearm. So really, the majority of our lymph is going to move along the hairless side of our arm, okay? But we're just going to work along that area, and we're just going to start just below the elbow, and we're going to stretch the skin up towards the elbow. And we're going to keep doing that as we move our way down towards the wrist. Again, 1 to 3, 3 to 5 strokes in each position, just to sort of feel, again, if you don't feel the stretch and you don't feel comfortable doing that stretch, just take a flat hand and stroke towards the elbow. Okay? Now this would be the very same as if you're going to be doing dry brushing. So dry brushing, again, you're going to start at the wrist, and you're going to take the dry brush and you're going to bring it towards the armpit. Okay? So you can do little circles bringing it towards the armpit. Okay? Or you can just use a dry brush, you can use a loofah, you can use your hand, whatever's easiest for you to be able to do this. Okay? Once we get all the way to the wrist, we're just going to work our way back up towards the armpit. And again, it feels really nice to just do one long stroke. Again, bringing it from the wrist all along the hairless side of the forearm to the elbow, crease of the elbow, and then towards the armpit. Then we're going to go back into the armpit, and we're going to do some more of those node compressions to really help move the fluid out of the arm. If you couldn't do any of the treatment down your forearm, and all you could do is the nodes in the armpit, that would be phenomenal. Because what's going to happen is, as I clean the lymph out of these lymph nodes, it's going to start pulling the lymph from the forearm, from the hand, all the way to the armpit. So again, we're going to just do some nice compressions into the armpit, and we're always going to go back to where we started to finish at the exact same spot at the base of the neck. So again, 1, 2, 3 fingers just above that nice joint at the base of the neck, and stretching that down towards your toes. All right? If you have any questions about helping move the lymphatics in your arm and you want to reach out to us, you're more than welcome to. You can send us an email at info@lymphbalance.com. You can visit our website, which is www.lymphbalance.com, or you can leave a message in the video comments, and we'd love to reach out to you. So if you have any questions or concerns, please do reach out. Again, this is just to sort of help in between sessions or until you can go and see a therapist yourself. So have a wonderful day and keep your lymph moving.